Learning disability and mental health. Introduction. People with learning disabilities and people with mental illness are marginalized citizens in our society. The fields of learning disability and mental health have a long history and are constantly at the forefront of new policy initiatives for promoting equality, choice and inclusion. This module explores the concepts of learning disability and mental health as two distinct fields and then discusses the mental health needs of people with learning disabilities. The mental health needs of children and young people with learning disabilities are often ignored, and their plight is highlighted in this module. Our societies and communities are increasingly becoming multicultural in composition, and therefore the issues of culture, ethnicity, learning disability and mental health are also discussed. What is a learning disability? The term learning disability has been in use in the UK since 1991, before which time the term mental handicap was used to describe people with a significant developmental delay which results in the arrested or incomplete achievement of the normal milestones of human development. The prevalence estimate of learning disability in England is based on service estimates and not on a total population study. It is estimated that there are about 210,000 people with severe or profound learning disabilities in England and about 1.2 million people with a mild or moderate learning disability. In Scotland, it is estimated that there are around 120,000 people with learning disabilities. In valuing people learning disability includes the presence of a significantly reduced ability to understand new or complex information, to learn new skills, impaired intelligence, along with a reduced ability to cope independently, impaired social functioning, which started before adulthood, with a lasting effect on development. The term learning disability should not be confused with learning difficulties, as the latter is more concerned with problems of learning in educational settings. However, many people with learning disabilities would classify themselves as having learning difficulties and wish to be associated with this term. According to the Education Act, a child having learning difficulty will require special educational provision. The Education Act defines that a child has a learning difficulty if one of the following applies. He or she has significantly greater difficulty in learning than the majority of children of his or her own age. He or she has a disability that either prevents or hinders him or her from making use of educational facilities of a kind generally provided for children of his or her age in schools within the area of the local education authority. He or she is under the age of 5 and is, or would be if the special educational provision were not made for him or her, likely to experience severe learning difficulties when of or over that age. The definition also includes statement to children who may have behavior problems. Many people working in learning disability services tend to use the terms learning disability and learning difficulty interchangeably to identify people with learning disabilities, which may be confusing. The substantial limitations in present functioning of an individual. It is characterized by significantly sub-average intellectual functioning, existing concurrently with related limitations in 2 or more of the following applicable adaptive skills areas, such as communication, self-care, home living, social skills, community use, self-direction, health and safety, functional academics, leisure and work. Mental retardation manifests itself before age 18. Policies and services. The major leap from devalued client group and segregated services to a trend-setting service user status with equal rights to generic services in the community was established throughout major social engineering processes by stressing the theme of consumerism. The care of people with a learning disability was becoming increasingly based in ordinary community settings, with the expectation of increased participation and take-up of generic services. The agenda of community-based services for people with learning disabilities was further reinforced, in a key speech outlining the ideological scene with 3 key value statements. That person with learning disabilities, of whatever degree, are entitled to be treated with the same respect and dignity as everyone else. They are people whose views and wishes, as well as their relationships and friendships, must be taken seriously and respected at all times. That people with learning disabilities should have their health and social care assessed on an individual basis, and not be offered predetermined sets of services because of ill-considered or outdated notions of what people with learning disabilities actually need or should be satisfied with. That people with learning disabilities have the same rights in relation to statutory services as anyone else. This includes the right of access to both primary and secondary health care as well as the right to have their needs for social care assessed. To secure this, in reality, means that any special difficulties they may have in enjoying equality of access and assessment must also be recognized and assessed. In the reforms following the implementation of the National Health Service, NHS, and Community Care Act, local authorities were entrusted with the lead statutory responsibility for assessing the care needs of people with a learning disability. Local authorities should plan and arrange a wide range of home-based, day and residential services by contracting them from the voluntary and private sector. An important aspect of this speech is the need to move away from the reliance and trust placed primarily on facilities to a system of care and support, which can be trusted. This is a vision of a system which disabled individuals and their parents or carers can trust to respond flexibly and sensitively to the needs and preferences which themselves may change significantly over time. Indeed, this notion of care has taken learning disability services to new realms of service planning and delivery, which is reflected in our current diversity of service provision. The notion of social care also acknowledges that even people with severe or profound learning disabilities do not need to spend their lives in the hospital simply by virtue of their disability. It is suggested that local authorities must assess each individual's needs and within the resources plan a package of services. This should be aimed at ensuring that the person with a learning disability receives care tailored to his or her needs in a setting that offers the most scope for the individual's development and well-being. This is a marked shift in the planning and delivery of services for people with learning disabilities, and indeed poses a major challenge to the thinking of professionals in both health and social services. The introduction of the NHS and Community Care Act made the purchasers and providers of all health care services, and the health authorities obliged to address the health needs of every individual within their district, and this included people with learning disabilities. A new strategy for learning disability for the 21st century in England reflects these themes and is based on the premise that people with learning disabilities are people first and they should, therefore, use generic services for health care. The vision outlined in this document is based on 4 key principles: rights, independence, choice and inclusion. These comprise the following: legal and civil rights, commitment to enforceable civil rights for disabled people in order to eradicate discrimination in society. People with learning disabilities have the right to a decent education, to grow up, to vote, to marry and have a family, and to express their opinions, with the help and support to do so when necessary. All public services will treat people with learning disabilities as individuals, with respect for their dignity, and challenge discrimination on all grounds, including disability. Full protection of the law is provided when necessary. Independence, commitment to promoting the independence of people with learning disabilities. While people's individual needs differ, the starting presumption should be one of independence, rather than dependence, with public services providing the support needed to maximize this. Independence, in this context, does not mean doing everything unaided. Choice, like other people, people with learning disabilities want a real say in where they live, what work they should do and who will look after them. However, for many people with learning disabilities, these are currently unattainable goals. Everyone should be able to make choices. This includes people with severe and profound disabilities, who, with the right help and support, can make important choices and express preferences about their day-to-day lives. Inclusion, being part of the mainstream, is something most of us take for granted. Inclusion means enabling people with learning disabilities to do ordinary things, make use of mainstream services and be fully included in the local community. In Scotland, a review of services for people with learning disabilities document identifies 7 principles, which will form the backbone to the development of services for people with learning disabilities. They are as follows. People with learning disabilities should be valued. They should be asked and encouraged to contribute to the community in which they live. People with learning disabilities are individuals. People with learning disabilities should be asked about the services they need and be involved in making choices about what they want. People with learning disabilities should be helped and supported to do everything they can do. People with learning disabilities should be able to use the same local services as everyone else, whenever possible. People with learning disabilities should benefit from specialist, health and educational services. People with learning disabilities should receive services that take account of their age, abilities and other needs. The mental health care of people with learning disabilities tends to be based on specialist inpatient units. The document stresses the need to access mainstream mental health services. In Wales, a report to the National Assembly for Wales entitled Fulfilling Promises. Proposals for a framework for services for people with learning disability propose that people with learning disabilities of all ages should have a right to similar good health as other people, to have their general health needs met by primary health care services, and to receive equity of access to secondary and specialized health provision as appropriate. A right to expect treatment from healthcare workers who have received adequate training in the recognition and provision of appropriate care. A right to skilled specialist help to diagnose and, if required, manage and provide appropriate support for particular conditions, such as autistic spectrum disorders. The Fulfilling Promises document states that people with a learning disability and mental health needs should be able to access local mental health services. In Northern Ireland, services for people with a learning disability are seen as part of learning disability hospital and community services. The mental health needs of people with learning disabilities continue to include hospital treatment for people with a mild learning disability in specialist services, and community-based treatment model is yet to be developed. In England, people have set a number of objectives, which form the backbone of transforming the learning disability services in England. By emphasizing a value base and the identification of clear objectives, this strategy document helps to place the person with learning disabilities and his or her carers at the center of seeking ordinary services. The government stresses the importance of working in partnership with people with learning disabilities, their carers and all agencies that provide services for these people, by setting up local learning disability partnership boards. The health improvement plan advocated in the strategy involves the use of mainstream health and social care services and identified health action plan and the appointment of health facilitators to the local community team caring for people with learning disabilities. Mental health and mental illness. It is estimated that 1 in 6 people of working age in the general population has a mental health problem. From a lay perspective, the terms mental health and mental illness may be used to indicate the presence of a psychological imbalance in the normal functioning of an individual in society. What is confusing in the literature and the healthcare setting is the use of these two terms interchangeably to indicate mental illness. The notion of mental health is not just the absence of mental illness, but a positive outlook on life and living, which involves the mind-body relationship, our inner thoughts, feelings and behavior, and a balanced psychological and social functioning in society. The physical and social environment of a person, his or her culture and belief systems, and in some cases, religious beliefs, are significant factors in understanding mental health. Definitions of mental health. Mental health is the capacity to live life to the fullest in ways that enable us to realize our own natural potentialities, and that unites us rather than separate us from all other human beings who make up our world. Mental health is a label, which covers different perspectives and concerns, such as the absence of incapacitating symptoms, integration of psychological functioning, the effective conduct of personal and social life, feelings of ethical and spiritual well-being, and so on. The following term facts on mental illness. The World Health Organization states that About 450 million people worldwide are affected by mental, neurological or behavioral problems at any given time. These problems are expected to increase considerably in the years to come. Mental problems are common to all countries. They cause immense human suffering, social exclusion, disability and poor quality of life. They also increase mortality and cause staggering economic and social costs. 1 in every 4 people going to health services has at least one mental, neurological or behavioral disorder. Most often, these are neither diagnosed nor treated. Cost-effective treatments for most disorders do exist and, if used correctly, could permit affected persons to be functioning members of the community. Yet, in most countries, there are major barriers to both the care and the reintegration of people with mental disorders. Setbacks include the lack of recognition, awareness and action. Policymakers, insurance companies, health and labor policies, and the public at large all discriminate between physical and mental problems. This discrimination leads to the stigma against people who need help. According to the Department of Health, mental health consists of the following 4 key capacities of an individual. The ability to develop psychologically, emotionally, intellectually and spiritually. The ability to initiate, develop and sustain mutually satisfying personal relationships. The ability to become aware of others and empathize with them. The ability to use psychological distress as a development process, so that it does not hinder or impair further development. Generally speaking, all individuals have their ups and downs in their mental functioning, but not everybody develops a mental illness. So there may be distinct biological, social and cultural stress factors that may trigger mental illness. It is very difficult to define what is mental illness, and in the majority of cases, the presence of mental illness is often associated with the manifestation of abnormal behavioral symptoms. The Mental Health Act defines mental disorder as the arrested or incomplete development of mind, psychopathic disorder and any other disorder or disability of mind. According to this Act, there are 4 categories of mental disorder. Mental illness, severe mental impairment and psychopathic disorder. It is generally believed that the field of psychiatry is concerned with mental illness or mental disorder, which implies that psychiatric disorders are disorders of the mind and not disorders of the body. Philosophically speaking, neither minds nor bodies develop illnesses. Only people, or, in the wider context, organisms, do so, and when they do, mind and body, psyche and soma, are usually involved. On the distinction between mental and physical illness, this is an argument that it may not be possible to identify any characteristic features of either the symptomatology or the etiology of so-called mental illnesses that consistently distinguish them from physical illness. The distinction between mental and physical illness is ill-founded and incompatible with contemporary understanding of the disease. It is also damaging to the long-term interests of patients themselves. The idea that mental illness is less real than those of physical disorders with tangible local pathology is confusing in the context of the complex mind-body relationship. Children and young people. Children and young people with learning disabilities and their families experience many difficulties in receiving adequate therapeutic services. It is estimated that there are about 1.7 million pupils with special educational needs in schools, and nearly 250,000 of these pupils have statements of special educational needs. The report of the Committee of Inquiry into Meeting the Mental Health Needs of Young People with Learning Disabilities estimates that 8.7 million people in the UK are between 13 and 24 years of age. Children and young people with learning disabilities experience the added burden of the stresses and strains of growing up. They face many additional barriers of lack of information and access to healthcare facilities and negative experiences such as labeling and isolation. Recent studies report a high prevalence of psychopathology in children and young people with learning disabilities, ranging from 30 to 50%. School leavers with learning disabilities often face difficulties in making a smooth transition from school to college and employment. The choices available to many young people after leaving school are very limited and for many do not exist. Transition to adulthood and adult services is a stressful phase for young people and their families. Young people with learning disabilities should have a transition plan worked out at school in consultation with the young person and his or her family. Only a few youngsters with learning disabilities had transition plans, and many had actually left school without a plan. Many young people had very little involvement in planning their future. The lack of a worked-out transition plan and coordination between children's services and adult services puts many young people and their families under enormous stress during this phase. There is also a lack of information about the various options available after leaving school for young people and their families. These and other socio-economic factors such as poverty, unemployment and poor housing put young people with learning disabilities at increased risk of developing mental health disorders. Ethnicity, mental health disorders and learning disability. Britain is increasingly seen as a multicultural society, with the promotion of cultural diversity seen as a slogan in public services such as health and education. It is fashionable to say that you live in a multicultural society, but the hidden realities and experiences of many people from diverse cultures are one of marginalization and racism. Minority and ethnic, BME, backgrounds have been present in large numbers in the UK since the Second World War. People from Africa, South Asia, the Caribbean, Ireland, Poland and Ukraine. Research in the last 2 decades has shown that many of these people face inequalities, discrimination and disadvantage in our society. People from BME groups form a significant part of the UK population, about 4.6 million people, 7.9% of the population. There are seen a steady rise in numbers of people from diverse cultures and religious beliefs in Europe and other Western countries such as the USA and Canada, and it is important to understand the prevalence of the spectrum of learning disabilities, its meaning in their cultures and its consequences in minority communities in order to adequately meet their needs. It is estimated that the prevalence of severe learning disability in South Asians aged between 5 and 32 years is up to 3 times higher than in other communities. Prevalence estimates in other minority communities in the UK are not well documented. There is a lack of information about the prevalence of mental illness and challenging behavior in young people with learning disabilities from the South Asian community. However, clinical practitioners and educational staff report that a number of young people from this community do experience emotional difficulties, which may be expressed through challenging behavior. The overlap of challenging behavior and mental illness in young people from the South Asian community often clouds the detection and diagnostic process and thus access to appropriate services. South Asian families supporting young people with learning disabilities at home often do so in the face of considerable adversity, poverty and poor housing and carers having little support from outside the family. Young people from Asian communities have limited social and recreational activities and limited social networks. All these trigger learning disability and factors place young people with learning disabilities from the South Asian community at increased risk of developing psychological disturbances, challenging behavior and mental illness. However, there is only limited service access and utilization by these young people. The mental health of people with learning disabilities. The belief that people with learning disabilities are not susceptible to mental illness is no longer a valid statement, as the policy documents clearly indicate the need for service to focus on the mental health needs of this population. Most psychiatric disorders are common in people with learning disabilities, and that the National Service Framework, NSF, for mental health, which applies to all adults of working age, is applicable to people with learning disabilities. The Valuing People document stresses the integration of the Care Program Approach, CPA, and care management. In line with the 7 standards identified in the NSF for mental health, the Valuing People document sets out the 7 areas of attention for people with learning disabilities in order to meet their mental health needs. The past 3 decades have seen a major shift in the model of learning disabilities from a dependent and medical model to that of an ordinary citizen with rights of equal access to and use of ordinary community facilities. The closure of the majority of long-stay institutions in the UK has led to the expansion of wide-ranging patterns of services in the voluntary and independent sectors. A steady shift of services is seen from the statutory sector to the independent and private sectors, with a heavy emphasis on individualized services to meet the needs of people with learning disabilities. You'll also see the integration of learning disability services as part of primary care and some of the specialized mental health services for people with learning disabilities merging with mainstream mental health services. Services for people with learning disabilities in the NHS tend to focus on specialized services such as health assessment and interventions, behavior and the mental health services. The changes in the service structure and patterns of service delivery have had a major impact on the key professionals working with people with learning disabilities, especially learning disability nurses. Learning disability nursing is one area that has had to adapt to constant changes in government policy and the resulting service changes due to the closure of long-stay institutions as a result of the community care legislation and the health and social care model of service provision. A sound knowledge base of the mental health aspects of people with learning disabilities is essential for learning disability and mental health nurses to work with this population.